Hi, my name is Tiffany Howard, and I am doing my presentation on eating and sleep weight disorders, sexual dysfunctions, paraphilia, and gender. So, what are eating disorders? Eating disorders are a range of psychological conditions that cause unhealthy eating habits to develop. This disorder can start with a food obsession, body weight, or body shape. Eating disorders are a complex illness and we don't really know what causes them. Sometimes eating disorders can come from genetics. Certain people may have genes that increase their risk of developing these eating disorders. Eating disorders are common in females and males. Most of the times, females in their teens develop an eating disorder. But just because eating disorders are common in women does not mean men are not affected. Statistics show that one every four children diagnosed with anorexia nervosa is a male. So, some major types of eating disorders are anorexia nervosa, which is the most well known eating disorder. An individual only eats minimal amounts of food, or they may exercise vigorously to offset food intake so that body weight sometimes drops dangerously. Next is rumination disorder, which is a condition in which a person throws up food they have previously chewed or swallowed. They re-chew it and either re-swallow it or spit it out. This typically occurs within the first 30 minutes after a meal. It is similar to the medical condition of acid reflux, but voluntarily. Next is bulimia nervosa. It's out of control eating episodes, are also known as binges, followed by self induced vomiting, excessive use of laxatives, or other attempts to purge or some way of getting rid of the food. Next is avoidant restrictive food intake disorder, which is a new term to replace what was used to be known as feeding disorder of infancy and early childhood. Previously reserved for children under 7 years of age, individuals with this disorder experience disturbed eating either due to lack of interest in eating or distaste for certain smells, tastes, colors, textures, and temperatures. Pica is eating items that are not considered food. Individuals that suffer from pica crave non food substances such as ice, dirt, soil, chalk, soap, cornstarch, laundry detergent, and etc. They normally suffer from an increased risk of poisoning, infections, gut injuries, and nutritional deficiencies. An example would be from the show My Strange Addiction that used to appear on TLC. And different individuals had different addictions to different things. So some were addicted to eating toilet paper and, as I previously stated, cornstarch and other things. Lastly is obesity. It is not actually considered an official disorder in the DSM, but it's considered as one. It is considered as one because it is one of the most dangerous epidemics confronting public health authorities around the world. And my chart shows bulimia nervosa, which is compulsive eating and then self-induced vomiting, compulsive eating again, and self-induced vomiting. So some stats and facts about bulimia is there's an overwhelming majority, 90 to 95% of individuals with bulimia, which are women. A large majority of males with bulimia are predominantly gay or bisexual. 6 to 7% of college women suffer from bulimia at some point. With anorexia, most people are either white or females. They come from middle to middle upper class families. Binge eating, there is approximately 20% of individuals in weight control programs that suffer from BED. An example would be Weight Watchers. And in my chart, it shows eating disorders with children and teens. So 90% of eating disorder cases occur in people ages 12 through 25. And of children who have anorexia, approximately 25% are male and 75% are female. So some media points. Lady Gaga battled bulimia during her teen years, and she stated that she always wanted to be a skinny little ballerina. Lady Gaga was Italian, and she grew up always eating spaghetti and pasta, and she used to ask her dad to, like, why did he always make spaghetti? And she always used to tell him that she didn't like it and she didn't want to eat it, and he would just tell her to continue to eat her spaghetti. And she spent most of her high school years throwing up because of her battle with bulimia. Also, two celebrities, Star Jones and Al Roker, both admitted to having weight loss surgery due to their morbid obesity. And here's a picture of Al Roker before he lost weight and then after he lost weight. Sleep-wake disorders. There are two major types of sleep-wake disorders, dysomnias and parasomnias. Dysomnias is difficulties in amount, quality, or timing of sleep, and parasomnias are abnormal behavioral and psychological events during sleep. An example of dysomnia would be if you have an 8 a.m. class or a doctor's appointment, but you can't go to sleep until 2 or 3 in the morning. And an example of parasomnias would be nightmares and sleepwalking. The most common sleep-wake disorder is insomnia, which is difficulty falling asleep at bedtime, problems staying asleep at night, or not feeling fully rested after having the proper or normal amount of sleep. So in our entire lives, we spend about 1/3 of our lives asleep. For most humans, that means we sleep nearly about 3,000 hours per year. Sleep can be energizing mentally and physically. According to Ohio developers and Reynolds in 2012, they reported that most people do not get enough sleep, and about 28% of people in the U.S. have reported feeling excessively tired or sleepy throughout the day. And some symptoms of sleep-wake disorder would be daytime stress, impairment in functioning, anxiety, and depression. Some treatments for sleep-wake disorders would be benzodiazepines, which is also known as benzos, which is a type of drug primarily used for treating anxiety. It also lowers brain activity and treats insomnia and seizure. You can also use over-the-counter sleep medications. For hypersomnia and narcolepsy, you can use stimulants such as Ritalin. The best approach for sleep-wake disorders is moving your bedtime to a later time, and the most difficult approach is going to sleep earlier. You can also use a bright light, which will trick the brain's biological clock. And some cognitive behavioral therapy for insomnia would be psychoeducation about sleep, changing beliefs about sleep, extensive monitoring, using a sleep diary, practicing better sleep-related habits, changing assumptions that individuals can't function well on little sleep. And to prevent some sleep-wake disorders, the best approach is actually practicing healthy sleep hygiene, behaviors that will lead to adequate quality and quantity of sleep. And another way to prevent sleep-wake disorders would be educating parents about good sleep habits for their children. Next, here I have a picture of the most clearest and comprehensive way to show your sleep habits, and it can be determined by a polysomnographic evaluation, also known as a PSG. So how a PSG works: the patient spends one or more nights in a lab and is monitored by several different levels, such as respiration and oxygen, desaturation in simpler terms, a measure of airflow, leg movement, eye movement, brainwave activity, and electrocardiogram. So here in the picture, you have the electrodes monitor the brain activity, belt monitors breathing, the electrode monitors muscle movements, the microphone which records snoring, and a nasal cannula which monitors the airflow. And then the next device is known as the actigraph, which is an alternative to the comprehensive assessment of sleep. This instrument records the number of arm movements, and the data can be downloaded into a computer to determine the length and quality of sleep. This device has been proven to be useful in measuring the sleep of astronauts during their space travel. So next I have what is normal sexuality, and I have some facts about 15 or more sexual partners in a lifetime. It's stated male is about 21.4%, female 8.3%, and sexual activity in older adults lasts usually past the age of 80. For males, it's 38.5%, and females 16.7%. And there's normally a decrease in sexual activity due to physical health changes as well. Next is my multicultural difference. So it's a picture of Sambian people in Papua New Guinea, and they have one of the most bizarre cultures. It's so bizarre to the point that anthropologist Gilbert Hertz described their ritual of initiation as ritualized homosexuality. In their eyes, they don't think of it as homosexuality. They don't think of the ritual as homosexuality, but they think of it as a ritual to attain male development. The ritual is necessity to attain the status of a warrior in comparison to weaker gender. And just a brief review of what their ritual is. Normally, when the boys turn about 7 or 9 years old, they're taken away from their mothers, and they are forced to perform fellatio, which is oral sex, on the older males, and they do not stop until they take in the semen. The belief is without the semen, which they refer to as male milk, they will fail to mature properly. They believe the semen contains gerangadu, which is a substance that will make the boys stronger. Next is sexual dysfunctions, which involves desire, arousal, or orgasm, and pain associated with sex. And some disorders would be genital pelvic pain penetration, female orgasmic disorder, erectile disorder, male hyperactive sexual disorder, desire. And so genital pelvic pain penetration disorder is basically difficulty with vaginal penetration during intercourse, pain during intercourse or attempts of penetration, fear and anxiety about pain during sexual activity, and tensing of pelvic floor muscles to anticipate sexual activity. And then also another one, erectile disorder is just difficulty achieving or maintaining erection. Sexual desire is intact and is common for men, and 60% of men experiences. Also, another one would be female orgasmic disorder, which is decreased intensity of orgasm in most sexual encounters, and 1 in 4 women have problems with achieving an orgasm. Some treatments for sexual dysfunctions is mainly education, just educating yourself and getting educated about sexual dysfunctions, and ignorance of the most basic aspects of sexual response cycle and intercourse often leads to long-lasting sexual dysfunctions. Next, I have paraphilia, which is the disorder of sexual arousal that causes distress or impairment to an individual or cause personal harm. And some common paraphilic disorders is fetichistic disorder, transvestic disorder, pedophilic disorder, and incest. And fetichistic disorder is basically the sexual attraction to non-human things such as feet, hair, and shoes. Transvestic disorder is sexual arousal when cross-dressing. Pedophilic disorder and incest is sexual attraction to children. Pedophilia is common with mainly males and is rare for females, but it does occur with females. And incest is basically the having sexual relations with close family members. My last slide is about gender. Gender dysphoria is basically feeling trapped in the body of the wrong sex, assuming identity of the desired sex. Gender identity begins between 18 to 16 months of 18 to 36 months of age. Fluid or cross-gender identity is not a disorder, only a disorder if it causes severe distress or impairment. So an example of gender dysphoria would be a show I used to watch it called I Am Jazz on TLC. It was about a girl and she was born a boy, and at 3 years old she told her parents she was a girl. She used to dress up as a girl, always used to wear her hair in ponytails. And so at that age she kind of knew she was a girl. She knew like she wasn't that she felt trapped in the wrong body. And so now she's about 19 to 20 years old and she's living as a female. So thank you.